So, apart from the pain and the stiffness, is there anything else would you like to tell me?
Uh, just pain, doctor, and it like it. I
Mm.
want help because it's affecting me.
Okay, okay. I will try my best to help you. All right. So, do you notice any redness or swelling on your hands, like fingers?
Not particularly. No, 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 no. There is not.
Okay. Do you have any fever, any flu-like symptoms?
Not fever. No, no, not fever. Not any flu like.
Mm. Okay. Do you feel pain on your shoulders or on your hips?
No, I don't feel pain on my shoulder or hips.
Okay. Did you injure yourself or anything like that?
No, no, doctor, I don't remember anything like that because yeah, no.
Okay. Do you notice any bumps on your fingers or anything like that?
A little bit, yeah, sometimes, yeah.
Oh, okay. What about on the other parts of the body?
Not other part of body, no.
Okay. So, is this the first time you seek the medical attention? Have you ever go to other doctors before?
No, no, I didn't. I couldn't make to any of the doctor. It's very hard to get the GP appointment.
Okay, okay. I understand. And thank you for booking this appointment to us as well. Okay.
Yeah, yeah, please.
Do you
Thank
have any underlying medical conditions?
you. No, no, I don't have any other condition, doctor.
Are you taking any medications?
Uh, yeah, just for the pain killer like paracetamol. That's it.
Okay. So does it help you, the paracetamol, while you're having the pain?
Yeah, sometimes it do help, but not all the time.
Okay. So do you have any allergy to certain food or medications?
Uh, I'm not allergic to anything, doctor.
Okay. What about in your family? Does anyone has any similar condition as you?
No, nobody.
Nobody at all. Okay. So could you please walk me through about your diet?
My diet is okay, totally fine, doctor. My diet is okay.
Mm. Do you smoke?
Uh, Off and on,
Okay. Do
but
you drink
not.
alcohol?
No, I don't drink alcohol.
Okay. So, well, this been affecting you for quite a long time, right?
Yes, yes,
So,
respect.
how has been affecting your daily life and activities?
Yes, doctor. I work as a typewriter, so that's why it's affect me a lot.
Oh, okay. I can see that you've been having it. How's your mood as well?
My mood is like okay, like seven, but just because of this condition, I don't feel good.
Do you have any thoughts of what might be the cause?
Sorry, doctor.
Do you have any thoughts about what might be the cause?
Oh, I don't know. Doctor, still struggling to find why. What would be the cause? I don't want to
Mhm.
know.
Is there any thoughts running on your head, like any concerns so far?
No, no, doctor. No.
Do you have any expectations particularly?
Expectation. I just want to feel better.
Okay, yes, we are here to help you about that. And thank you for telling me your valuable information as well. So I would like to examine you.
Mm-hmm.
By taking vital signs such as blood pressure, temperature, I would like to examine your hands and joints as well. Would that be okay?
Okay, okay.
Okay. Uh, Thank you
And
for
you will see
letting
the
me.
picture in which that there you could see the picture of rheumatoid arthritis. Yeah.
Okay. Thank you for sharing me this really valuable information. Thank you for letting me examine you. From the conversation we had, you've been having this for quite a few times by quite a long times by now. And I'm suspecting that you might be having a condition called rheumatoid arthritis. Have you ever heard about it before?
Yes, yes, yes. I have heard of it, but I don't know what it is.
It's okay. I will try my best to help you with it, okay?
Okay.
So, rheumatoid arthritis is a long-term condition where your body, so the cells in our body, okay, their job is to fight something like foreign things. But in your case, what happened is those cells couldn't recognize on our own and they start to fighting themselves each other.
Mm-hmm.
It
Okay.
is, yes, it is an autoimmune condition, and that's why you're feeling this lumps on your finger and you're feeling the pain and the stiffness.
Okay. Oh, I see, doctor. So what you would do for me then, doctor?
Thank you for asking me this question. So I would like to refer you urgently within 3 days to the specialist,
Mm-hmm.
which is called,
Oh,
yeah, the other bone specialist.
okay. Thank you very much. That's so nice of you, doctor. They would see me in 3 days.
Yes, they will see you within the 3 days. So currently I will give you some painkiller. I understand paracetamol doesn't help you. So I will give you the ibuprofen along with the omeprazole. So that will help your stomach as well, since this medication is a bit strong.
Oh, I see. I see. Okay. So that's so nice of you, doctor. So what the
Mhm.
specialist would do that they would treat me for that, or they would do something surgery, or what they would do?
Mm. That is a really good question that you asked to me. So the specialist, what they will do is they will run some investigations,
Mm-hmm.
okay, like rheumatoid factor and also the advanced investigation to see what might be the cause. And
Oh,
also yes, and also doctors will do the X-ray,
okay.
okay, And
Thank you very much. Thank you. Thank you. Thank you. Well done, May. So now I would like to ask you guys to debrief, and I want to involve you guys, all of you. Thank you, Dr. Nu. So anyone want to comment on her consultation? So I can, yeah, it was. Thank you, Noor. It was quite helpful. Anyway, I want to debrief this consultation. First of all, I would like to tell you, Dr. May, your the way of talking is very like you calm all the time, and the fluency is very like a very polite doctor. And I, being a patient, I was feeling so good that this doctor is helping me overall. The way of communication, you was communicating, you were using your hands, you were giving full focus to me, you was listening properly to me, and this is what, being a patient, I was feeling so. And the other thing is, in terms of guidelines, so I will go one by one and I'll tell you how I was scoring. Yes, our history taking was on point, exactly. So if you just see the history taking part, so she done the Socrates. Have you done the Socrates or not? You just tell me. Have you done the Socrates? So she done the Socrates. Even she did ask about it only on the joint or on the muscle as well. So she did ask about that, how long it's been going on, and she did ask about redness and stiffness of aseptic arthritis. She did ask. Did you ask about rash on the face?
I didn't ask about
So
SLE.
yes, so she did miss one part, the rash of SLE, which could be one DD. She did ask about fever, redness, like other problems. In the DDs, what else did you ask about? I want to.
Yes, I asked about OA and also osteoarthritis. I asked about
Yes,
shoulder.
she done the PMR, osteoarthritis, big joints, and she did ask about how does it trigger. Again, the Socrates, the base, the main thing is Socrates. Where, when, how did it started, how long it stays, does it stay long? So he asked me every question, and I
I
answered that question.
was that
Yes,
an
yes.
occupation as well? Dr. Noor asking. Yeah, I
Yes,
asked.
she did ask about occupation. I told that I'm a typewriter,
Yes.
and I work is involved with the typing. Well done. Or she might say I'm secretary, or my work involved in typing, all that stuff. So in Naftosa, she have you covered family history? Definitely. And smoking and alcohol, good. So obs wise, so history wise, I must give you 4 out of 4 in history because you covered everything in the history. So your history taking was very fluent and everything was good. So now coming to the part that, have you managed the concerns of the patient? Have you managed the concerns of the patient? You did ask about ICE. Have you done ICE?
Yes, I did then the ice
And you
before.
done psychosocial as well. That how it's
Yes, I
affecting
asked
your
you.
life, affecting
Yes.
your job. So well done at that point. And on examination, you said the examination of hands. Then how you explained about rheumatoid arthritis, you said it's an autoimmune condition that your own body things get fighting. You explained that well, but what things can improve on? When you came to the management, you always do with the priority one. So at the moment you're having pain, so we'll consider some like NSAIDs, pain relief with the PPI one. And other thing what you can offer, the good thing you have done, you want to refer her in 3 days pathway, urgent. That is the fast track because it's affecting her life and it's on the multiple joints. So you have done it, and well done in that point as well. And you also offered you need to tell that what that they would do. They would do a further investigation, including inflammatory marker, ESR, and will do few other tests. Like there are the few specific markers. They might check the urea of you in your blood. So that will rule out other thing as well. Inflammatory marker, infection marker like CRP, ESR, and we'll do X-ray. You mentioned X-ray at the end, but you should have mentioned X-ray in the start as well. So they might do an X-ray. So start with telling what they would do. They would do inflammatory markers, they would do infection marker, and they would do some special factors check to find out this condition is rheumatoid arthritis, and you suspect that. And you will say that, as we are in the GP, I will try to help you with your pain relief, but when you go to see your specialist, rheumatologist, bone specialist, he might start you on steroids. He might start you on steroids and special medicine. Okay. And on top of that, because it's affecting your life, you got difficulty, I would ask you to do a self referral to the physio, or I will refer you to the physiotherapist as well. Okay. If you do that, then I would do like management was also 4 out of 4. But this point, the management wise, I'll give 3. IPS, I'll give 3. So you're scoring 10 in this consultation. Well done. So good. So that was done good. So now I'll quickly show the scenario. So from the rheumatology, what type of scenarios you can expect in the rheumatology section. So I'm going to share the screen now. So everybody can see screen now. Yes, well done. So the similar scenarios can appear in the rheumatology. So 40-year-old lady presented with the pain in her hands. You are 40-year-old lady, you have been in hands, pain in both sides. You have gradual onset of pain for past 4 weeks, work as a secretary. In hospital, find that pain is worse when typing. You have also morning stiffness in both hands. So morning stiffness in both hands, lives with her husband. So do ask, say this 10 days, can have some risk factor, paracetamol. So in similar scenario, you can have in those scenarios. What other scenarios can come in that one? So other one will go with the back pain. So I would like to do one scenario with the back pain. So May,
Yes, yes.
so you will, because this is very important scenario, which I want to tell you can come from back pain scenarios, especially back injuries, or it can be related to the, it's not related to the rheumatology, but it can be related to the back pain, in which like one is upper back pain, that is ankylosing spondylitis, and one is lower back pain. So whenever you are going to see a lower back pain, how you would do that scenario. So I will tell you. So I am 45-year-old. So you repeat this scenario, and you will act like a patient. I will act like a doctor. And so let me do my screen.
I had a case in my exam about the back sprain.
Okay, so back
Yeah.
sprain is okay, but I want to do like if you do know the quad equina symptoms. So I want to do the quad equina. So that
Okay.
so that would help people, because it's one of the important scenarios. Keep coming
Yes.
in different exam setting in real life as well, because it's a dangerous thing. So
Yes.
you know, you will have some findings. So you are 35-year-old or 25-year-old female. You was working at home and you just tried to bend. When you was bending, at that point, what you had, you felt like a very pain. It's a pain, is sharp pain,
Mhm.
and okay.
May I ask how long the day like is going on? It's been going on for like 3 days or 4 days?
The pain, we can say that pain could be like, we can say that it just suddenly started after bending, and it can be 2 to 3 days. Like one episode previously had, but now the pain got worse. But you would get some bladder symptoms. You're not able to control your bladder. You have tingling and numbness around your legs. Back passage examination. There would be like tone decrease, and on both leg you would have some numbness and tingling sensation. Both SLR positive. Okay. So your name is Lita, and I'm one of the doctor in A&E, and we are going to do simulations for quad equina. You'll be acting like a patient. You just need to give few findings for quad equina. I'll try to do everything with that. Okay.
Okay.
So we'll start now.
Okay. So the timer, who will do it?
So timer, I will keep the timer. Okay. Hello, hi. I'm Dr. Ghaffar, one of the doctor here. Is this Lita Brown?
Oh yes, I'm Lita Brown and I'm 35 years old.
Hi, Lita. Can I call you Lita? That be okay?
Yes, of course, yes.
Nice meeting you, Lita. Uh, I can see from my notes that you have some pain in your back.
Yes, yes, really bad pain.
Oh, I can see that you are in pain. I'm here to help you. By any chance, you got any pain relief?
No,
Do you got
no,
any?
nothing at all.
Oh, you haven't got any pain relief. I'll make sure that you get a pain relief now. Okay, that be okay? Can you
Okay,
please tell me how much pain? Can you please grade your pain for me, please?
it's like 7 or 8.
Oh, it's quite a lot. So
Yes.
definitely, I need to give you some pain relief. I'll ask my colleague to get you pain. You're not allergic to anything, isn't it?
No, I'm not allergic to anything.
Okay, okay. Yeah, is that okay? Can I ask you a few more questions about
Oh,
that?
yes, please.
Okay, can you please briefly tell when does the pain started?
Well, the pain's been going on for like 3 or 4 days by now.
Oh, okay, 3 or 4 days. And anything specific you remember what happened that pain started?
Yeah, I was just bending in my house, just doing my chores, and then all of a sudden I feel just really bad pain. And I thought it was just a normal pain and I couldn't really focus on it. And then it happened and the
Oh,
pain is going on for like continuously and I couldn't do anything anymore. Yesterday it is
oh,
really the
oh,
worst.
bless you. I'm really sorry to hear about that. You're going through this, but make sure we'll find out what's happening, what's going on. You mentioned that you bended yesterday. By any
Mhm.
chance, you didn't had any fall or any trauma over there?
I couldn't recall.
Okay, you didn't, by any chance, you had a fall, bang your head, nothing. Oh, good, quite reassuring
No.
to know that. Okay, is this pain is just staying around your lower back? Is that right?
Well, it goes to like from my thighs to the leg too.
Oh, I
Yes,
see. Okay, that pain is on the lower back and it goes
yes,
both of your legs.
yes, yes, yes.
Okay, right. And is this stay all the time or comes and goes?
Well, mostly right now it's continuous. I thought it will come and go.
Uh, Anything make it better? Seems to make it better.
I tried ibuprofen in my home, so I tried, but it doesn't help me at
Mhm.
all. So
Okay.
that's why I came here for the medical attention.
Anything make it worse?
Oh, me staying like this, it just
Oh,
makes it worse. Whenever I bend down or anything like that, it makes it worse.
okay, okay. So, just the last one.
Yeah.
Can you describe pain for me, like how it seems like it's a sharp pain or some?
Oh,
No.
yes, it is a really sharp pain.
Oh, sharp pain is like sharp. Okay,
Mhm.
thank you very much. Anything else along with the pain? Any other symptoms you got? Like,
Like what?
by any chance, you lost control of your bladder, like
Yes, I do. Yes, I just noticed myself that I'm
Oh,
facing this problem too.
okay. So it happened today.
Yes,
Have you
and
passed
yesterday
your
as
V
well.
today? How many times do you pass your V today?
I couldn't remember that one, but whatever you mentioned to me, I'm facing it.
Oh, okay. And what about by any chance you swallowed yourself?
Could you please repeat?
By any chance you swallowed yourself, poo? You
Oh
able to
yes,
control your poo?
I did. I feel like I'm losing control.
Oh, I see. It happened first time.
Yes, it's going on for the first
No.
time. Yes.
Okay. All right. Any tingling sensation around your legs or private part?
Oh, I do lost sensation on my private area.
Oh, okay. Okay, I'll make sure that everything is okay with you, all right? Do you have any blockedness around your tummy or pain in your tummy?
No,
No pain around your tummy.
no,
Any recent fever or flu?
no,
Any lumps and bumps in your body?
no,
Okay. And burning sensation while passing B?
no,
Any weight changes recently?
no.
Thinking of your general health, by any chance, any other medical condition you
Huh?
had?
No, not really.
Okay. Any non-allergies at all?
No,
Any family history of similar problem or somebody else has the same symptoms? Okay.
not that I ever aware of.
Okay. What do you do for a living?
Oh, yeah, I'm just a housewife.
Oh, okay. So it's more of like bending thing involved in your stuff, like you do more of like, oh, I see. Okay.
Yes, I just do the house chores, lifting things, and
Okay.
and then it just happened. I don't know why.
Oh, sorry for that. That must be stressing you out as well because this thing is going along even from last three
Yes,
days.
it is.
Have you
It
ever,
is stressing me out.
oh, sorry. Have you given a thought what could be the cause or something like?
I'm not sure why. Maybe because of I'm trying to lift something heavy, and maybe I just get
Mhm,
normal back pain.
mhm.
But me couldn't pee well, or me just just
Oh,
like swaying myself. It
yeah.
really worrying me.
Mhm,
Never happened to me before.
mhm. Definitely, I'll try to help you what I could. Okay, so just a quick one now. Any particular expectation you have for me today? What you
Uh, I just want to know what's wrong with me.
Yeah, definitely. So at this point, I would like to take your a sample of your urine. I will do a bladder scan of your tummy to see that you're not retaining anything. I need to do a back passage examination. For that, I will use a lubricated finger in the presence of chaperone to assess your sphincter tone. I will examine your nerves of your legs, hands as well, legs, and your back passage area. That be okay with you?
Yes, okay,
So sphincter tone.
okay. That
Oh, it's
okay.
okay.
So
The sprinter
yeah,
tune is okay. So, Lita, after having a
yeah.
chat with you, after examination of getting examination of you, I just want to tell you at the moment I'm thinking something serious might be going on. There's some nerves on our back. We call it quad equina. Sometime while bending, you was bending can get compressed. That's why the symptom you're getting, like bladder control and back passage control, is compromised. Am I making sense to you?
Okay. I feel like this is really serious.
Yes, it can be because at the moment I think, but don't worry, we need to refer you to the orthopedic department. Before that, I will order MRI for you so that you'll get MRI done as soon as possible. For in the best case scenario, if it's not, it's okay. Not nerves are not compressed, that's okay. But if it's compressed, the orthopedic department might have do urgent surgery in which they will decompress those nerves in the back. Shall I repeat for you? Is that making sense to you?
No, it's okay. So I need to stay in the hospital then.
Yes, we need to keep you in the orthopedic department. Our orthopedic surgeon would come and reassess you and will wait for your MRI results. In any case, if it is compression of the quad equina nerves, they will do the surgery on that. Before that, shall I repeat anything for you?
No, sorry, it's all
I would
right.
like to give you some reading material about quad equina.
Well, you finished it.
I tried to finish it anyway. So, guys who are taking the class, can you debrief that? How could have the quad equina has done better way? So, Mera, Ashwi, Zubda. Yes, Saban. Yes, I asked her that I will give pain relief. So she allowed me. So if I have, because I'm not gonna give the imaginary pain relief, definitely if someone is having lower back pain, the first thing I would be offering back pain in the real life. Nobody's not gonna do the examination before. So I have asked her in the start, shall I give you pain relief? And definitely I would say that, but I can't say that let me get a pain relief or something. Definitely we do give pain relief and muscle relaxant as well. And the most important thing is that need to refer to the orthopedic department for urgent surgery. Yeah. Any question?
The
Okay.
only thing I would like to say
Yes.
is
Yes. Yes. Please.
you repeated allergy twice, I think.
Oh yeah. Yeah. Maybe
Yeah.
because
You
yeah.
asked in the beginning.
Again,
First
yeah.
in the
Definitely,
beginning.
when you're doing consultation in 8 minutes, it's not every time because you get absorbed in. So basically, guys, I want you guys to get over the pressure of consultation. So try to practice in front of mirror, go through A to Z guideline because now if your exam is in June or May, it's totally changed in terms of presenting complaints. So you have A to Z. I'm going to write. You have A to Z. Most of the thing is from the same syllabus you have done in your medical school and everything, but NHS A to Z, go through NHS A to Z and few of the short ebooks we will be providing you guys as well. So in the meantime, I would like to advise you just focus on the lectures what we are giving. Try to observe how we are doing practicing. Try to practice and go through NHS A to Z. Or if your exam is on the UK MLA, they have the course map. Just go through those things. Otherwise, the previous scenarios are already circulating in the PLAB2 groups and different. If you go through that, it's okay. But the thing is, how you deliver it is important. Our way of delivering it is we are going to show you algorithms, and after those algorithms, we definitely will be providing you a few more stuff like audiobooks, ebooks, and everything, so that will make sure that you get everything. But in the next part after this days, once you're done with your 10 days, what we are expecting, we are going to arrange supervised practice with you guys. So in which you will be doing the same what we are doing. So if you don't ask question now, if you don't speak now, that would be, it would be very late. So for now, if you want to participate, you want to tell anything, I would advise you to come on front, ask questions, say something, and this is how you'll get over this pressure because it's an exam of talking only. So I'll quickly share my screen again and I'll go through the rest of the scenario of the back pain. There is another scenario of upper back pain. So let me quickly share my screen again. And what I'm going to show you is, so headaches part, we already covered the headache thing. So I'm going to show you some scenario from rheumatology. And then Dr. May would do another scenario. I'll give another scenario to Dr. May as well to do. Before that, I want to do a scenario with the Dr. May. So this is the back pain. This is upper back pain. Which previous one was the lower back pain. This is upper back pain. The presented with the back pain, have back pain for 6 months, worse in the morning, improves with the exercise. This is ankylosing spondylitis. So in ankylosing spondylitis, what you would do in ankylosing spondylitis, guys, what you would do, write in the chat box, what would be the history and what is ankylosing spondylitis? What do you think ankylosing spondylitis is? If anyone wants to tell, they can speak through the mic as well and they can tell us what is ankylosing spondylitis. So, guys, do you know what is ankylosing spondylitis? What question you will be asking ankylosing spondylitis? And what would be the history, the patient age? What would be the age of patient you would be expecting in these type of scenarios? So, let me tell you a few things. Yes or no? Just tell me. Someone who's having ankylosing spondylitis, how long history would be? Is the short history or long history? What would be the presenting complaint? So answer my questions. Presenting complaint. Presenting complaint, guys. Young male, back pain, genetic inflammation. Well done, Zabda. So, guys, please participate. That will motivate us as well, motivate me. Mornings, well done, Saban. So, stiffness, morning stiffness. He would say, when I go to gym, when I do exercise, I feel better. Thank you, Khadija Sejwani. Morning stiffness of the back. Then, what you would do, you will ask again, Odipara of the stiffness. You will ask other questions or pain if it is. Then go for other symptoms because it's a back pain. Same question what I have done. Do you have any problem while passing B? Do you have problem in passing bladder? Weight loss? Any loss of weight? Any bruising? Abdomen pain? Urology? Do relate those things together so that you rule out everything of quad equina. That's why I told you in the back pain scenarios, you will try to rule out quad equina as well. However, it would be the upper back pain, but still it's a back pain. So you will still rule out quad equina here. So meptosa, what things you can get positive in meptosa? So family history can get positive. And will you do SLR? Yes, you will do the SLR, will not be positive. No lower urinary symptoms will be positive. How would you explain ankylosing spondylitis? A long-term condition in which spine and other area of the body become inflamed. So it's a long-term condition in which the body parts get inflamed. However, there is no cure for that, but the treatment is available. Don't worry. What you're gonna do? Would you refer it? Would you refer? Where you refer it? So let's read the scenario, then do it one by one. You experience morning stiffness. The pain is worse when he doesn't go to work. He is in bed the whole day, and pain gets worse by evening. You work as a bus driver, and it was affecting your work. You also experienced stinging sensation on the thigh. Your father had back pain, was diagnosed with prostate cancer, and died. So here you will stop and say sorry to hear about that. You are worried it could be cancer. You also have psoriasis, which you take topical steroid and it's well controlled. So you have nothing to do with psoriasis. So only the treatment. So guys, I give you 1 minute. Write down the management plan for ankylosing spondylitis. I will write mine in the chat box. I want you to write yours. So referral, where to do the referral. So my priority order is I will do referral. I will give some analgesia. Will I give analgesia? Which analgesia will you give? Will you give NSAID? Will you give anything along with NSAID? For example, you are giving the pain is too much. For example, you are giving naproxen, for example. What will you add on with that? Or if you are giving NSAID, you will add PPI. If you are giving codridamole, which will be the combo of paracetamol, combo of paracetamol and codeine. And you would say that the specialist might consider what? Steroids. Specialist might consider steroids because it's a lifelong condition. What non-medical things you would offer? So let me explain to you, Mr. Michael. So let me do it for you. Okay, let's do it together. Let's do the management. So I have told you everything. Anyone want to try the management part only? So May.
Hello. Yes.
Yes, May. So you want to try the management, or should I try management? In 2 minutes. In 2 minutes, you have to manage ankylosing spondylitis. Or anyone else want to? Zubda, you want to try management? Let's ask them. Zubda, you want to try management?
Yeah, sure. Yes, I can.
Hi.
Zubda.
Hello.
Oh, sorry.
Okay, no problem. Yeah, okay.
So
yeah.
I have to be the doctor and you're the patient?
I am the patient. You have to manage me. You tell me that I got ankylosing spondylitis, and you have to manage me in 2.5 minutes or 2 minutes. Okay.
Okay. Now we know about your condition. So I'll offer you some management plan. First, you'll have to do exercise, and I'll refer you to, or you can book an appointment with a physiotherapist, or I can do that for you. And I will offer you some painkillers. Are you taking any painkillers already?
Yeah, doctor, I'm already taking. That's not helping at all.
What are you taking?
I'm taking paracetamol.
Okay. I can give you some other painkillers like ibuprofen or some
doctor, I can't have it because it caused me some stomach problems. I don't like it.
Okay, then we will give you some alternatives like codeine, etc.
Okay.
And we will refer you to the rheumatologist, and they might offer you some other medications like steroids or monoclonal antibody and other treatments.
Oh, thank you very much, doctor. Thank you.
Yeah, and I'll give you a leaflet to give you some more information about your condition. Yeah, that's it. I can.
Okay. Thank you very much, doctor. Yes, Khadija, you want to try it, Khadija? Thank you very much, doctor.
I haven't studied this, but I can try. Okay.
Yes, right. Go on.
Okay. So what was your name? Patient's name?
Call me Mr. Brown.
Okay, Mr. Brown. So from what you've told me, and after examining you, I feel that you have what we call ankylosing spondylitis. It's basically an inflammatory autoimmune condition of the back, in which your body's immune system is attacking your own cells. All right. So what we will do is I need to do a few tests. So I will do a special test called HLA-B27. It will basically confirm the diagnosis for me, and apart from that, I will do all the usual blood tests, like the inflammatory markers and full blood count, kidney function, liver function tests. And what I would suggest is that you start with the physiotherapy. I will give you all the necessary details, and we can get you in contact with a physiotherapist. Exercising will really help with this condition. Are you following?
Yeah. All right.
Okay. And apart from that, because you mentioned that the pain is so severe, I want to offer you some painkillers as well. Will that be all right?
Yes. Okay. Thank you.